Hi everyone, just wanted to go over a couple of concepts. This is probably going to be fairly brief because there wasn't a lot to go over this week, but just did want to talk briefly about our discussion boards. Actually, the term adverse selection, which was one of our discussion board terms, did come up in the quiz as well, and that was one question that seemed to be a little problematic, so I did want to go over that. But first, I want to talk about the discussion board question with regard to substitutes and complements. So I think you did a good job on that, and I think again, I apologize that there's so few of us here in class. Unfortunately, there's not a lot we can do about that, but I think you're doing a great job of discussing and keeping the discussion going. So I appreciate that. But so substitutes and complements, I think you did a great job picking which ones are substitutes for one another versus which ones are complementary of one another. And I think it was Marco that had mentioned about physician and hospital services, how they can even serve as both. You think about how they can be substitute for one another. And I think to, without having the discussion open in front of me, I think to how there are many folks, I know it's a problem here in the town where I live, but there are many folks that use the hospital as their primary care physician's office, going to the emergency department, uh, or just simply using the hospital as a physician when they probably shouldn't, versus where the hospital services are really a complement to the physician services, perhaps just to receive outpatient ancillary services or even inpatient hospital services in conjunction with the care they're receiving from their physician. So it really can serve as both, and it can be in both in that case. But a lot are meant to be like physician services, and prescription drugs are really complementary to one another in that the physician would provide an order for that pharmaceutical, and it would complement the use of the pharmaceutical would complement that physician care. Same with dentists and dental hygiene services. They The hygienist works in conjunction with the dentist. They're not really substitute for one another. You really need to receive full dental care. You really need both of them to provide that care. So good work in that, and I think that hopefully that can give you an idea of the difference between services that are substitute versus what are complementary, and also how in some cases, especially in healthcare, because obviously that concept is much broader than the healthcare industry, but in some cases there can be a kind of a double of that. Adverse selection. We talked a little bit about moral hazard and adverse selection. Moral hazard, everyone seemed to have a good handle on that, but adverse selection I wanted to talk a little bit about. So adverse selection, it's obviously not, none of these terms are just used in healthcare. They're a much more broad term used just generally in economics. But in the healthcare industry, adverse selection really tends to be something that we see in the insurance arm of our industry. And adverse selection is really focused on the fact that there are times when, in the insurance industry in particular, one person, one element of the purchase typically, or one element of the, be it the consumer or the seller, has information that the other doesn't have. And it typically is the consumer. So oftentimes, I'll just use an example here. And I had made this example in the classroom, I think, in one of the discussion boards. But so right now, my husband and I are trying to pick new insurance because he's going to work at Duquesne. So we're losing the insurance that we have now and trying to move to his insurance at Duquesne. And they have two plans available to us, a high deductible health plan and a more comprehensive PPO plan. Now, I have the information that I have a chronic illness that requires a large number of pharmaceuticals every month, and regular physician visits. So, so there's two pieces of information that I have. Um, he actually has 4 plans available to him: 2 high deductible health plans and 2 PPO plans. 2 of the plans are through UPMC, which is I know that we have at least one person. Actually, no, we have 2 people that are from out of the area. So so UPMC is obviously the largest health system in the Pittsburgh area, but their plans require you to only see UPMC providers. If they're not, they don't let you see anybody else. The other 2 plans that are available to us are Cigna, which are, obviously Cigna, national insurer, very, very broad network. So the fact that I could only see UPMC, sorry about that, my other video just finished saving. So the fact that I could only see UPMC providers and I don't have any providers outside of New York State would be problematic because none of them participate with UPMC. So that takes us to the Cigna plan. So I have a high deductible health plan and a PPO through Cigna. Now I have the information that I have these conditions, so that's automatically going to push us to that PPO. Now the PPO is priced the same for me as it is for a very healthy person. They don't have the information that I have these illnesses, but so this is the concept of adverse selection. I am going to be choosing these plans based on my needs. They don't know what my needs are, and these types of this information is not available to them and is not made available to them. It's not the type of plan where they can make a difference in there. It's a group health plan, so it's honestly none of their business what my what my health concerns are until I start submitting claims. Now, there was a day with private health insurance where you would have to submit information, and they could say, "Oh no, sorry, you have that pre-existing condition; it's not covered." But obviously, those days are gone. Number one, private health insurance is all but gone in this country due to the health exchanges. And number 2, pre-existing conditions are obviously that's a thing of the past as well. But so the notion of adverse selection is kind of that issue of pooling of patients that have more serious conditions to these plans that have better coverage, and pooling of patients that are well to these cheaper plans. That's a notion of adverse selection. And I think actually that what I'm concerned about is what's going to happen in 2019. So in 2019, we are seeing the individual mandate, which is the notion of having to have health insurance in this country or pay a penalty, pay a fine. That's going away in 2019, right now. So I think what I'm fearful of is all of the very healthy people that are currently paying fairly high premiums for health insurance under the health exchanges will get rid of their health insurance because they don't see it as a benefit to them. So a lot of people will get rid of their health insurance because they don't feel that they need it. And the people that are remaining on those health exchanges will be the sicker people. And that's going to raise those premiums because those risk pools are now going to get riskier because it won't be balanced by those healthy people. So hopefully that makes a little bit of sense. Adverse selection is that notion that both the buyer and the seller sometimes neither have a pertinent piece of information that is directing people to a particular plan. And in my case, Cigna's offering me these 2 plans. If they were smart, they would force everybody to the high deductible health plan, and it would put everybody in the same pool. But they're not doing that. They're offering these 2 plans because Duquesne wants to offer 2 plans to everybody. And actually they offer 4 plans to everybody, but they want to offer 2 plans, and the likelihood is that the sicker people will go to that PPO plan and the healthier people will go to the high deductible health plan. And that's the notion of adverse selection. There is this dichotomy of higher spending people in one pool, lower spending people in another pool, and that's unfortunately just the nature of that beast. So, so that is adverse selection. I don't think I had anything else in particular from the classroom. Generally, the other quiz questions were okay. Maybe one person missed it. If there are any questions on them, please let me know. I'm happy to answer that. And other than that, I guess I will see everyone in the discussion boards this week. Okay, thanks so much.